We thank you for joining us this morning for our first press conference of the 2021 legislative session. The last time the Mississippi Legislative Black Caucus was gathered here in this location, there was a state flag bearing the Confederate battle emblem waving above us. And we're happy to announce and join in the celebration that that has changed. But I never would have imagined that on the same day the bill was making its way through the Senate and was passed, ratifying the change of the design for the flag, insurrection and lawlessness will be perpetrated on our nation's capital. We are in a time of civil and social unrest, but we're thankful for our national leaders who had the fortitude to reassemble themselves and certify the vote of the Electoral College. We are looking forward to living, working, and existing under the Biden-Harris administration. We've invited you here today to present our 2021 legislative policy agenda. Our agenda consists of about 30 action items or bullet points on matters of health care, education, criminal justice, election reform, and economic justice, all presented for the purpose of benefiting our communities. Our caucus has been meeting with advocates, lobbyists, and concerned citizens during the months of October, November, and December to craft our agenda. And without further delay, I will mention some of the points that we intend to advance as a caucus. As it relates to health care, there are no easy solutions to the health care issues that face the state of Mississippi. COVID has wreaked havoc on many of our communities, and there are still individuals who are suffering, contracting the virus, and succumbing to it in certain instances. We would like to see the expansion of Medicaid using the Affordable Care Act as a model. Initially when COVID was diagnosed and began to move throughout the state and other parts of the country, we know that minority communities were hit extremely hard. And with the expansion of Medicaid, we believe that that will help those individuals to receive the medical care that they need in order to stand up and fight the virus. But we also have other legislative matters pertaining to health care. We would like to see the implementation of waivers, more waivers, for the elderly, disabled, and traumatic brain injury patients. We would like them to receive service as promptly as they can. We would like to see the PACE program, which is a program for all-inclusive care for the disabled and elderly, enacted in the state of Mississippi. We want Medicaid recipients to receive 4 brand prescriptions and 2 generic prescriptions per month, which would increase the services that they are currently receiving. We would like to see the fee for dental services increased for those providers who are servicing Medicare patients to the private level of reimbursement. We would also like to see 12 months of postpartum care provided to those women who are receiving Medicaid benefits. Long-acting reversible care contraceptives for women who are childbearing age should be provided by Medicaid. And we also would like to see our chemical dependency beds in the state healthcare system increased, especially for those facilities or those beds that are inactive. Teacher shortages, that continues to be a problem. We want the MAEP program, Mississippi Adequate Education Program, fully funded, as we've called for in previous years. We're advocating for 100% connectivity of broadband access as well as fiber optic capacities throughout the state. For those teachers who are willing to go into C, D, and F districts, we would like them to receive incentives whereby they can manage their student loan debt, which would also serve as a recruitment tool in those areas. Mississippi teachers need to receive a pay that reaches the southeastern average, and we need to develop a plan for that rate of pay to be maintained. High school students who graduate in the state of Mississippi, should they desire to pursue community college as a means of higher education, that community college tuition should be free to them. As it relates to economic justice, Mississippi is the only state in the union that does not have a law prohibiting discriminatory lending practices. That's going to help in the area of housing as well as financial literacy. We would like to see a law on the books in that regard. In terms of funds for the Capitol complex, for right here in the city of Jackson, we would like a program devised that would allow for a bond issue to be passed and that structures would be implemented to allow for the retirement of that bond indebtedness. Criminal justice. Criminal justice, or the Department of Corrections in the state of Mississippi, is fraught with issues. And the Mississippi Legislative Black Caucus endeavors to advocate for policies and procedures that will promote fair prosecution of criminal defendants. State inmates will be adequately housed in facilities that are habitable, and that when those inmates are released, their reentry will be supported into society. And to accomplish that end, we would like to create a fund that would allow indigent defendants to receive. We would like indigent defendants to have the benefit of a state public defender system. We want criminal penalties to be eliminated for the possession of marijuana in the amount of 2.5 ounces. We would also like marijuana penalties we want the state to be in a position to tax and receive revenue from the possession of marijuana, so eventually we want those criminal penalties phased out. And we will oppose any bill that comes across our desk that proposes to be a gang bill, because we know that those bills, by their very definition, criminalize activity that is otherwise unlawful. Our last agenda item is that of election reform. And it could not be made more plain as what we've seen during the course of the past 45 days, where individuals have had to wait in long lines to vote. There is no early vote program or statutes here in the state of Mississippi, and we do believe that that is unfair to the citizens of this state who want to exercise their right to vote and to do so safely. So we would also like to see an online voter registration program. And we do want those individuals who their right to vote has been taken away from them, we want programs implemented so that their rights can be restored. I thank you for being here today. And as you see, and let me just say this, our press conference was duly noticed for today. Our members are standing here. We're standing to make sure that we present the agenda that we want to forward and advance. And as we move through different parts of the state, we're frequently asked, what is the Mississippi Legislative Black Caucus doing for us? And we have attempted to make sure that we are gathering, that we are receiving the concerns of our constituents, and that we are looking at current legislative policies, as well as policies that we can introduce and move forward for the future. This is our right. And unfortunately, the person that is standing across the street from us, that is his right as well. But we will not be silenced. We will continue to work. We will endeavor to do all that we can despite our numbers, because the policies that we stand for are right and they are good for our citizens. I will now yield for questions. Yes.
Some of the members have spoken to this in recent days, but can you speak to any momentum that you wanted to build from after seeing the members in both the House and Senate last year work towards getting the flag change, work towards some level of criminal justice reform, even though the governor did veto it? Are you hopeful that there is some momentum to be built?
I am hopeful, and I think what we've seen with the measures that have passed the recent ballot initiatives, medical marijuana has passed. The provisions changing how our elected officials, how those the elections for our statewide offices are completed. I believe it shows that the citizens of Mississippi are frustrated and tired with a small few coming here to the Capitol and passing laws that affect all of us. We've heard, they've shown us at the ballot box what they want to see. People are looking for progress and they're looking for change. Yes, we intend to harness that momentum to continue our work. And despite, a lot of these bills have been introduced time and time again, and if you have a chance to speak with some of our more seasoned members, they can tell you about the conversations that they've had with leadership, with their colleagues to try to advance these issues that have gone fruitless and unheard. But we will continue to fight. Yes.
Vote to pass that in the Capitol. Is there any, do you know of any effort to do that through an initiative process, or is it, I know that's not what y'all are do, but this seems like that might, they've done that in other states, and I just wonder if that would be, is there any momentum to do that in Mississippi?
I can't say that there is at this point. Those are conversations that we will continue to have, and certainly, we have access to the media here today. We hope that they are listening to us and that they will receive our message. But just like other issues have not gained momentum from here in the Capitol, there's been a push that has come from the community. We welcome that to do that in this regard as well.
Is on the lines of voting, is no excuse early voting in person? Is that something that kind of you will be pushing for, or is there a different sort of specific proposal in terms of that could lessen the long lines that we saw in the future?
We would propose no excuse early voting. I would say in person, and then if this other agenda item receives popularity, online as well, or mail in, but certainly something longer, better than people just having to wait or get caught up in this convoluted absentee ballot process that we have. Are there any other questions?
You mentioned something about waivers, health waivers for certain groups. Can you specify a little bit more what you meant by that?
Yes, that's there's currently a waiting list for individuals who are elderly, disabled, and who have suffered traumatic brain injuries. We would just like to see more funding allocated for that program so that they will not have to wait as long as they have in the past. Any other questions? Well, again, we thank you for gathering with us today and for receiving our comments. We will deliver these agenda items to the leadership for the various chambers, and we will also, these will be presented to on the Senate side as well as on the House side for bills to be introduced. And if they can't be passed standing alone, we will certainly try to get the process, get them in by way of amendments. So thank you all, and we look forward to speaking with you in the future.